Welcome back to our channel. Today, we're delving into a topic that affects millions worldwide: urinary tract infections, or UTIs. Join us as we unravel the mysteries of the urinary system, explore the factors contributing to UTIs, and learn how to prevent and manage these pesky infections. But before we delve into our topic today, if you haven't already, please consider subscribing to our channel and ringing the bell to be notified about all our exciting future videos, so you never miss out on our health and wellness content. What is a urinary tract infection? A urinary tract infection, UTI, occurs when bacteria infiltrate any part of the urinary system, comprising the kidneys, ureters, bladder, and urethra. Women face a higher risk of UTI development compared to men. When confined to the bladder, a UTI can be both painful and bothersome, yet if the infection spreads to the kidneys, it can lead to serious health complications. The kidneys make urine as they clean your blood, removing waste and extra water. Usually, urine travels through your body without any germs. But if bacteria get in, it can cause UTIs. What is the urinary tract? The urinary tract makes and stores pee. It includes 1. Kidneys. They are small, bean-shaped organs on the back of your body, above your hips. Most people have 2 kidneys. They filter water and waste products from your blood, which becomes pee. 2. Ureters. These are thin tubes that carry pee from your kidneys to your bladder. 3. Bladder. This is a balloon-like organ that stores pee before it leaves your body. 4. Urethra. The urethra is a tube that carries pee from your bladder to the outside of your body. UTIs aren't always accompanied by symptoms, but when they do show up, they can be quite noticeable. Symptoms may include 1. Persistent urge to urinate. 2. Burning sensation while urinating. 3. Frequent urination with minimal output. 4. Cloudy urine. 5. Urine that appears reddish or pink, indicating blood. 6. Unusually strong smelling urine. 7. Women may experience pelvic pain, particularly in the pelvic center or around the pubic bone. It's important to be aware that in older adults, UTIs can often be overlooked or mistaken for other medical conditions. Types of urinary tract infections. Each type of UTI presents with its own set of symptoms, depending on which part of the urinary tract is affected. 1. Kidney infections, pyelonephritis. Symptoms can include back or side pain, high fever, shaking, chills, nausea, and vomiting. 2. Bladder infections, cystitis. Look out for symptoms like pelvic pressure, discomfort in the lower abdomen, frequent painful urination, and the presence of blood in the urine. 3. Urethral infections, urethritis. Symptoms may manifest as a burning sensation during urination and discharge from the reproductive organs. What causes UTIs? UTIs typically occur when bacteria enter the urinary tract through the urethra and begin to spread in the bladder. The urinary system is designed to keep out bacteria, but the defenses sometimes fail. When that happens, bacteria may take hold and grow into a full-blown infection in the urinary tract. Infection of the bladder. This type of UTI is usually caused by Escherichia coli bacteria. This is a type of bacteria commonly found in the gastrointestinal tract. Having sex also may lead to a bladder infection, but you don't have to be sexually active to develop one. All women are at risk of bladder infections because of their anatomy. In women, the urethra is close to the anus. The urethral opening is close to the bladder. This makes it easier for bacteria around the anus to enter the urethra and to travel to the bladder. Infection of the urethra. This type of UTI can happen when gastrointestinal bacteria spread from the anus to the urethra. An infection of the urethra can also be caused by sexually transmitted infections. They include herpes, gonorrhea, chlamydia, and mycoplasma. This can happen because women's urethras are close to the vagina. Exploring the risk factors associated with UTIs. Understanding who's most vulnerable. Urinary tract infections, UTIs, are a prevalent concern, especially for women, who often find themselves grappling with recurrent bouts throughout their lives. Let's dissect the specific risk factors that make certain individuals more susceptible. These risk factors include 1. Female anatomy. Women's shorter urethra provides a shorter path for bacteria to journey into the bladder, increasing the likelihood of UTIs. 2. Sexual activity. Engaging in sexual intercourse, particularly with a new partner, heightens the risk of UTIs for women. 3. Birth control methods. Certain contraceptives, such as diaphragms, and the use of spermicidal agents can elevate UTI risk. Factors affecting both genders. 1. Urinary tract issues. Babies born with urinary tract abnormalities may face difficulties in urination, leading to potential UTIs. 2. Urinary tract blockages. Conditions like kidney stones or an enlarged prostate can obstruct urine flow, raising the risk of UTIs. 3. Compromised immune system. Diseases like diabetes can weaken the body's defense against germs, increasing susceptibility to UTIs. 4. Catheter usage. Individuals reliant on catheters for urination, whether due to hospitalization, neurological conditions, or paralysis, face UTI risk. 5. Recent urinary procedures. Surgical interventions or medical examinations involving the urinary tract can also escalate the likelihood of UTIs. Understanding these risk factors not only sheds light on the challenges faced by those prone to UTIs but also underscores the importance of proactive measures in prevention and management. Complication that arises when you do not treat UTIs properly. Urinary tract infections, UTIs, though often perceived as minor nuisances, can escalate into serious health concerns if left unchecked. Let's delve into the potential complications that can arise. Recurrent infections. While lower urinary tract infections typically resolve with prompt treatment, recurrent episodes can become a troubling pattern. Women, in particular, are susceptible to frequent recurrences, with 2 or more UTIs within 6 months or 3 or more within a year becoming a concerning trend. Kidney damage. Neglecting to treat a UTI can lead to a progression of the infection, culminating in a kidney infection. If left unchecked, this can result in permanent kidney damage, underscoring the importance of timely intervention. Pregnancy complications. UTIs during pregnancy pose risks not only to the mother but also to the developing fetus. The presence of a UTI during pregnancy can increase the likelihood of delivering a low birth weight or premature infant, highlighting the critical need for prenatal UTI screening and management. Urethral complications in men. Men experiencing repeated UTIs of the urethra may develop a narrowed urethra, complicating urination and potentially leading to further health issues. Sepsis. Perhaps the most severe complication, sepsis can arise if the UTI progresses unchecked, allowing the infection to ascend to the kidneys and potentially enter the bloodstream. Sepsis is a life-threatening condition requiring immediate medical attention. Understanding these potential complications emphasizes the importance of vigilance in recognizing and treating UTIs promptly. Stay tuned as we answer the questions most people affected by UTIs ask. Can you get a UTI from your fingers? Yes, it's possible to get a UTI from your fingers. Your hands can pick up bacteria and other microorganisms whenever you touch a surface. You can accidentally introduce bacteria to your urethra when you go to the bathroom or during sexual acts, including masturbation or fingering. It's a good idea to wash your hands before and after going to the bathroom or having sex. How do you know if you have a UTI? If you have symptoms of a urinary tract infection, talk to a healthcare provider. They'll ask questions about your symptoms, review your medical history, and conduct a physical examination. They can also order tests to help confirm a diagnosis. What tests will be done to diagnose a urinary tract infection? A healthcare provider may order the following tests to diagnose a UTI. 1. Urinalysis. During this test, you'll pee into a special cup. The provider will send the sample to a laboratory, where technicians will examine it for signs of a UTI using multiple variables such as nitrites, leukocyte esterase and white blood cells. 2. Urine culture. You'll pee into a special cup, and lab technicians will test your sample to grow and identify any bacteria that are present. Urine cultures are important because they help your provider determine the most appropriate treatment. If your infection doesn't respond to treatment, a provider may order the following tests to examine your urinary tract for a disease or injury. 3. Ultrasound. An ultrasound is an imaging test that helps your provider look at your internal organs. It is painless and doesn't require any preparation. 4. Computed tomography, CORT, scan. A CT scan is another imaging test. It's a type of X-ray that takes cross-section images of your body, like slices, that create 3D images of the inside of your body. It is more precise than a standard X-ray. 5. Cystoscopy. A cystoscopy uses a cystoscope to look inside your bladder through your urethra. It is a thin instrument with a lens and a light at the end. If you get UTIs frequently, a healthcare provider may perform tests to check for other health issues, such as diabetes or an abnormal urinary system, that may contribute to your infections. Can I become immune to the antibiotics used to treat a UTI? Every time you use antibiotics to treat a UTI, the infection adapts and can become harder to fight, antibiotic resistance. But the infection becomes immune to the antibiotics, not you. Antibiotics may not always be the best solution. As a result, a healthcare provider may suggest alternative treatments if you get frequent urinary tract infections. These may include waiting. Your provider may suggest a watch and wait approach to your symptoms. During this time, it's a good idea to drink plenty of fluids, especially water, to help flush out your system. Can a UTI go away on its own? Minor urinary tract infections can sometimes get better on their own. However, most UTIs need antibiotics to go away. Does cranberry juice prevent a urinary tract infection? Cranberry juice that you can buy at the grocery store doesn't prevent a UTI. However, cranberry extract supplements, vitamin pills, may decrease your chances of getting a UTI. How soon after treatment will I feel better? Most people feel better within a few days after starting antibiotics to treat a UTI. When should I go to the ER? Go to the emergency room if you have a UTI and develop the following symptoms. 1. Fever. 2. Back pain. 3. Vomiting. What specific antibiotics are used to treat a urinary tract infection? The following antibiotics to treat UTIs. 1. Nitrofurantoin. 2. Sulfonamides, sulfa drugs, such as sulfamethoxazole, trimethoprim. 3. Amoxicillin. 4. Cephalosporins, such as cephalexin. 5. Doxycycline. 6. Phosphomycin. 7. Quinolones, such as ciprofloxacin or levofloxacin. To prevent urinary tract infections, UTIs, adopt the following lifestyle changes. Practice good hygiene, especially for those with vaginas, by wiping from front to back after bowel movements and avoiding vaginal deodorants. Stay hydrated by drinking plenty of fluids, particularly water, to help flush out bacteria. Maintain healthy peeing habits by emptying your bladder regularly and before and after sex to reduce the risk of bacterial buildup. Consider alternative birth control methods if using a diaphragm increases UTI risk. Use water-based lubricants during sex and avoid spermicides if prone to UTIs. Opt for loose-fitting clothing and cotton underwear to prevent moisture buildup. Discuss with a healthcare provider the use of vaginal creams containing estrogen for postmenopausal individuals. Consider over-the-counter supplements like cranberry extract and probiotics, but consult a healthcare provider before starting any new regimen. UTIs are a common and often troublesome health issue affecting millions worldwide. Understanding the causes, symptoms, and risk factors associated with UTIs is crucial for prevention and management. By adopting simple lifestyle changes, such as practicing good hygiene, staying hydrated, and maintaining healthy peeing habits, individuals can significantly reduce their risk of developing UTIs. Additionally, seeking prompt medical attention and adhering to prescribed treatments are essential steps in managing UTIs effectively and preventing potential complications. Remember, proactive measures and awareness are key to maintaining urinary tract health. Don't forget to subscribe to our channel for more valuable insights into health and wellness. Stay informed, stay healthy.